And good morning, Dr. Dorsey. Thank you for joining us. We've had a great response from our constituents who have joined us today. I think we're up to close to well over 30 people at this point. So thank you for joining us. Dr. Dorsey was well documented in our registration piece on our website as far as his background. And he is the author of Ending Parkinson's. I don't know if that looks like you're looking in a mirror, but I can tell you I heartily recommend the book. I learned so much including things that I think impact my family. So I would encourage everyone, if you get a chance, to wherever you get your material, check out Ending Parkinson's Disease, A Prescription for Action. So a little bit about housekeeping, if I can. In a moment, I'm going to mute everybody's microphone, and we'll have Dr. Dorsey get started. He's informed us that he likes to have a very interactive session. So he would like to field questions. We've gotten some questions from some of the group in advance. So he has a few advanced questions, but he would like very much to have participate in this by asking your questions. In order to do so, since your mic will be muted, if you would look at the bottom of your screen, once again, use your cursor, you'll notice that icon bar where the microphone and the video are. To unmute your microphone, you'll just have to click on that microphone icon, which is far to the left. But in order to have some semblance of organization here, if you would first indicate right in the middle of that bar, you'll see the chat with the little word bubble. If you would just click on that, and then you can send to me or to everyone just the fact that you have a question, and I will ask you then to unmute your mic and ask your question and begin your dialogue with the good doctor.
And Chris, before we get started, can you tell me a little bit about where everyone is and a little bit more about your group?
Well, it looks like a lot of folks are in their living room. So Parkinson's Support and Wellness. Back in the early part of this century, a group of folks here in the greater Cincinnati-Dayton area started the tri-state chapter of the American Parkinson's Disease Association and worked with them for a number of years. However, it was felt that while we were doing good work in supporting the American Parkinson's Disease Association in creating and providing educational material and in providing monies for research into Parkinson's disease, we felt that there was a gap in services locally to folks with Parkinson's and their families and loved ones that needed to be filled, that would provide programs directly to our constituents. And our board decided that we would start a new organization called Parkinson's Support and Wellness. We informed the American Parkinson's Disease Association that we were going to no longer act as the tri-state chapter with them, but that we wanted to maintain a friendly relationship, and we have ever since. And in 2015, incorporated as a nonprofit based in Cincinnati. We are fortunate enough that we have office space donated to us by the University of Cincinnati and their neurology department, actually their academic neurology department. So we are on the greater campus of the University of Cincinnati. We shrunk our service area from Ohio, Indiana, and Michigan and being in the southwest corner of Ohio, not very close to Michigan, we shrunk our service area to about 32 counties in south and west and west central Ohio, in northern Kentucky, and in central and southeastern Indiana. That population is estimated to have between 7,000 and 8,000 folks who have been diagnosed with Parkinson's disease. There are neurology organizations, practices that serve our community in Dayton in particular, in Cincinnati and in northern Kentucky. And we maintain close relations with them. Our mission is to provide a meeting place, a resource to the Parkinson's community for information about the disease and how it affects the community, to provide a clearinghouse so that there is information available on physical exercise and physical therapies and other therapies for Parkinson's disease specifically. We have approximately 60 such organizations and instances of Parkinson-specific therapies in our service area. We list those in a matrix on our website that is organized into, first of all, online and in person, and then also by neighborhood and day of the week. We also support, support groups. While we don't run support groups, we try to provide resources to support groups in the area. There are, at current count, 40 such support groups that we're aware of in our service area. And then finally, the educational component. We try to provide resources, pamphlets, et cetera, but then we also do what we dub the PD EDU, and this is an instance of that. So 1 hour or so informational seminar. We do them monthly. Cheryl, Carol, Patty, Nancy, not naming all of them, but Julia, they all participate in our program committee that sets these up. I want to thank Cheryl in particular for contacting Dr. Dorsey and convincing him that we would be worth an hour of his time. We're looking forward to this as a discussion. So in a moment, I'm going to go ahead and mute all the mics. If you have a technical problem, you can email me or or text me. My text phone number is 513-805-3603. Probably the best way to do that.
Thank you very much, Chris. So I don't know if you guys know, I'm a native son of Cincinnati, Ohio. I went to Cincinnati Country Day School. If you can believe it, I'm still wearing the uniform. Wow. I got a navy blazer. I got a stripe on my shirt, so I would have to do push-ups wearing stripes on my shirt. That wasn't allowed. I do have gym shoes on, but other than that, I think I still have a lot of Cincinnati in me, and delighted to be with all of you. A lot of great friends still in Cincinnati, Ohio. So delighted and very excited to be with all of you. Unfortunately, Cincinnati is not spared from Parkinson's disease. Actually, my best friend's father had and died from complications from Parkinson's disease. So I know a little bit about the toll that all of you are bearing. And we wrote this book to prevent other people from bearing the same burden that you are bearing currently. And that burden is borne not only by the person with the disease, but by their friends and family as well. And second, to put forth a path to help end the disease for those who already have it. And that's through improved care, so you can get care wherever you are in your home, and to get better treatments for the condition. And so I'm going to tell you a little bit about our book, maybe read an excerpt from it, and then answer any questions that you have. How does that sound?
That sounds great. Doctor, if you'll give me a second to go ahead and hit the mute button on everybody, and then if you'll unmute yourself,
Yep.
it would help. So. Doctor, it's all yours.
Beautiful. Thank you again, Chris. So let me see if we can get some slides up here.
And by the way, you totally made sure that we knew you were from Cincinnati. The first thing you told us is what high school you went to.
And then, Chris, if you can let me share my screen, that would be great.
Okay.
So I left in 8th grade, but I spent, my sister graduated from Country Day. My older brother actually graduated from Indian Hill High School.
All right, why is it not
if you pick the shield, there's a shield. There should be a shield on the bottom part of your thing. If you click on that shield.
Got it.
And then there's something that says share screen.
Yeah, you should have that now.
Perfect. All right. Let's see what we got.
There we go.
You guys all good?
It's good.
Outstanding. All right. So Parkinson's disease, as you may know, is the world's fastest growing brain disease. The world's fastest growing brain disease is not Alzheimer's disease, it's Parkinson's disease. And that's why we wrote this book. And we think to a large extent, many cases of Parkinson's disease are man-made. And that means that they're preventable and that we can prevent many cases of Parkinson's disease. So I'm going to tell you a little bit about man-made diseases, then talk to you about the rise of Parkinson's disease, then talk to you about how we can end it, and then answer any questions that you have along the way. So the French-American scientist René Dubos wrote that every civilization has its own kind of pestilence and can control it only by reforming itself. Translated into modern English, every society creates its own diseases. Every society creates its own diseases. And that, some are really clear, car accidents are a product of our desire to use 2-ton vehicles to transport ourselves. If we got rid of cars, we'd get rid of car accidents. But, many cancers, much of type 2 diabetes, many other conditions, cancers, heart disease, are all products of things that we have done as a society and as individuals. And to the extent we can change our behaviors as a society and individuals, we can prevent a lot of suffering in the world. In 1971, a really smart epidemiologist, Dr. Abdul Amran, wanted to know what led to population growth or changes among just humans. And he put forth 4 stages of epidemiology, which is just the study of disease. And he said early humans died from pestilence and famine. So they're quite simply, there wasn't enough food to eat. And so that prevented population growth. But about 10,000 years ago, we had the agrarian revolution, and therefore we were able to start to store food and form cities. And with that ability came the ability to have population growth. And the thing that limited a lot of the population growth was periodic pandemics. Think about the bubonic plague in the 1400s or 1300s, and the influenza pandemic in 1918. And he says, now we live in the age of degenerative and man-made diseases. And the future, he thinks we're going to suffer with delayed degenerative diseases and emerging infections born out of hubris. And we still know exactly what has caused the COVID-19 pandemic, but whether it's poor animal husbandry practices or other causes, some of those could be born out of our own shortcomings. And the poster child for man-made disease is lung cancer. So if you look at this graph and you look at lung cancer deaths in the 1920s, you can see that at one point, lung cancer almost didn't exist. So if you look at like 1925, 1930, there were almost no lung cancer deaths in the United States. And the reason no one died of lung cancer wasn't because we had really effective treatments for lung cancer in 1925, it's because the disease just didn't exist. It was considered, before cigarettes, was considered as a once in a lifetime oddity. All the doctors and medical students would gather around when they saw a case because they thought they'd never see one again. But we introduced cigarettes in the late 1800s, first in England, then the United States. And 25 years after the introduction of cigarettes, we see a rise in lung cancer deaths. And one of the great public health achievements in the last 30, 40 years, especially in Cincinnati, Ohio, right across from Kentucky, has been our decrease in smoking. And with that decrease in smoking has seen 25 years later, a corresponding decrease in lung cancer deaths. So lung cancer is to a large extent man-made. It quite simply didn't exist until we started smoking cigarettes. And once we stopped smoking cigarettes, we see lung cancer deaths diminish. And I'm going to argue that's a framework for thinking about Parkinson's disease. Because Parkinson's disease, before Dr. Parkinson described it in 1817, was extraordinarily rare. There are rare descriptions of Parkinson's disease in ancient Greek and Egyptian and Chinese and Indian texts, but there wasn't very much. In fact, Dr. James Parkinson, who described the condition in 1817, said he was describing something that hadn't been classified in the medical literature. In short, the 61-year-old doctor was describing 6 individuals with a condition that was new. He'd been practicing medicine for 30 years and was the son of a physician. So he'd been around the block a few times. And if you're 61, what's going to get you out there to write a paper is something that's catching your eye and that's new and unique. And after he described the condition in 1817, the French neurologist Jean-Martin Charcot named the disease after him, calling it Parkinson's disease, or La Maladie de Parkinson's. And then we're going to go now. In the 1950s, we identified that dopamine was deficient in the brains of individuals with Parkinson's disease. 1960s was the development of levodopa, the most effective treatment for Parkinson's disease, most effective medical treatment. In the 1980s, we started to find out what were some of the causes of Parkinson's disease. A really smart neurologist, Dr. Bill Langston in Santa Clara Hospital, identified that young individuals were developing what looked like Parkinson's disease overnight. And what he found out was that there was a contaminant in a street form of heroin that they were using. And that contaminant bears a striking resemblance to certain pesticides. And after that, several pesticides and then other industrial chemicals have been identified as likely contributing to the rise of Parkinson's disease. Later, the first genetic causes, which are responsible for about 10 to 15% of individuals with Parkinson's disease, were identified. The Michael J. Fox Foundation was formed 20 years ago and has raised $1 billion for Parkinson's disease research. But despite that, the burden of Parkinson's disease has been increasing. As I mentioned, it's the fastest growing neurological disorder in the world, and the number of Americans with Parkinson's disease has increased 35% in just the last 10 years. So what was going on when Dr. Parkinson, who was a radical at the time, described Parkinson's disease? Well, he described it in London. He described it in 1817. And if you think back to your history, London was the capital of the Industrial Revolution, and the height of the Industrial Revolution was right around the time that Dr. Parkinson described the condition. And the London fog had little to do with weather and everything to do with air pollution. This is a picture of the London fog from 1847. You couldn't even see across the street. You needed boys with torches with fire sticks to be able to simply walk the streets of London. And if you look at the woman and her husband and likely son behind on the sidewalk, you can see they're all covering their mouths because of the toxic effects of the air pollution. And since that time, air pollution has been associated with Parkinson's disease. It's been associated with Alzheimer's disease. It's associated with cancer, and it's associated with heart attacks. In short, if you want to live a short life, live in a polluted area. And since that time, Parkinson's first expanded likely in Western Europe with industrialized nations, and then the United States and the United States. And so you can see from 1990 to 2015, the number of people with Parkinson's has more than doubled. And if we do nothing, if our generation of individuals who now know what is contributing to the rise of Parkinson's, if we do nothing, the number of people with Parkinson's will more than double again in the coming generation. So it's not just you who's going to have Parkinson's disease. It's going to be your spouses, your brothers, your sisters, your cousins, your nieces, your nephews, and even your children. But the challenge to us is to change the course of Parkinson's disease, just like we've changed the course of polio in the 1950s, like we changed the course of HIV in the 1980s, and like the way we're changing the course of breast cancer today. So as many of you know, the earliest symptoms of Parkinson's disease aren't tremor or slowness in movement or a shuffling gait. They're loss of smell and their constipation. And those symptoms can precede the diagnosis of Parkinson's disease by years, if not decades. It's worth then considering that the pathology of Parkinson's disease might begin in the nose and in the gut. And it might also implicate that the causative factors related to Parkinson's disease might begin in the nose and in the gut. So while you're taught that, well, we're taught that Parkinson's disease is a brain disease, I want you to think of Parkinson's disease as a multi-system disease, and that where it begins and where the earliest pathology is found provides powerful clues to where the disease, what's causing the disease. And indeed, in 2003, a German pathologist named Dr. Heiko Brock, who's still living, postulated that Parkinson's disease doesn't begin in the brain, that begins either in the nose or the gut, and that the pathology of Parkinson's disease can be found first in the gut in some individuals and in the nose in many individuals, and then makes its way by passing along nerves, including one nerve that goes all the way from your gut all the way to the lower part of your brain before passing into the parts of the brain that are responsible for tremor and movement, and then later into the parts of the brain that are responsible for thinking. And that's why, for example, that dementia is a late manifestation of Parkinson's disease corresponding to the spread of the pathology of the disease. If you look at where Parkinson's disease is found, you will find that the highest rates of the disease are in the industrialized parts of the world. The lowest rates of the disease are in the least industrialized parts of the world, like sub-Saharan Africa. And where Parkinson's disease is growing most rapidly are in those areas of the world that are undergoing the most rapid industrialization. And that also corresponds to air pollution, as shown on this graph. And if you look at China, the rates of Parkinson's disease adjusted for age in China have more than doubled in the last 25 years, such that there are probably nearly 2 million individuals with Parkinson's disease living in China today. Other factors that have been linked to Parkinson's disease are certain pesticides. Pesticides are nerve toxins. They attack nerve cells. They target the certain parts of the cells called mitochondria that we know are damaged in Parkinson's disease. Many of them are fat soluble, so they dissolve in the brain. And when you feed some of these pesticides to animals, to laboratory rats and laboratory mice, they develop the behavioral features of Parkinson's disease, including shaking in their legs, and they develop the pathological features of the disease when you look at their brains. And synthetic man-made pesticides, while natural occurring pesticides have been around for centuries, for millennia, synthetic man-made pesticides really were introduced in World War II and came into use shortly after that. Some of you might remember about DDT, which was widely and indiscriminately used in the 1950s and 1960s, and led Rachel Carson to write her book, Silent Spring. I'll read you a little, okay if I read, good with reading? Alistair says I can read. So this is from chapter 4 of the book. And you mentioned Michigan, and this features a family from Southwest Michigan. And it's chapter 4 is before it starts, the urgency of banning specific pesticides to lower our risk.
Rachel Carson from Silent Spring wrote, "The farmers spoke of much illness among their families. In the town, the doctors had become more and more puzzled by new kinds of sickness appearing among their patients." The chapter begins, "Over the past 40 years, 5 members of Terry McGrath's extended family, including her beloved grandfather, developed Parkinson's disease. In 2005, then a 49-year-old special education teacher, McGrath noticed that when she walked, her left arm was not swinging and her left foot was dragging. 3 years later, she became the 6th member of her family and the first woman to receive the same diagnosis. In the 1920s, McGrath's father, Alex Adent, and 9 of his brothers and sisters emigrated from Lithuania to the United States. Most of the sisters became seamstresses, and most of the brothers, including McGrath's grandfather, became farmers in southwestern Michigan. Ever since then, McGrath's family life has centered on a farm in St. Joseph, a small town on the eastern shore of Lake Michigan. Her 86-year-old mother spent her entire life within 2 miles of that farm. As a child, McGrath was always playing outside with her grandparents. The family regularly used pesticides on its farm, including DDT, until it was banned in the United States in 1972. When the older family members sprayed the chemicals, McGrath stayed inside because her grandmother did not want her to breathe them in. But McGrath would often slip outside soon after, while the pesticides still lingered in the air. She, her siblings, and cousins would all pick apples, currants, and grapes that were covered with a white film. Only after her diagnosis did McGrath learn how dangerous some of those pesticides were and how some were linked to Parkinson's disease. McGrath loved growing up on that farm. Despite her diagnosis, she says that had she known about the harmful effects of pesticides, she's not certain she would have done anything differently. Her children, who are now all super conscious of what they eat, are surprised that their mother did not think more about the risk of pesticides. McGrath says, "I just didn't think about it. I thought farming was fun." And while farming is fun for many individuals, these pesticides are dangerous. And while DDT was banned in 1972, there's a pesticide called paraquat that's been banned by 32 countries, including China, because of its health concerns, but the United States hasn't banned it. Indeed, in fact, the use of paraquat has tripled over the last 25 years, doubled over the last 10, and increased by 20% from 2016 to 2017. Paraquat's found in farms in southwest Ohio and around Cincinnati and Indiana and in Kentucky and all the way into Michigan, as well as in many parts of the country. It increases the risk of Parkinson's disease by 150%. So if you want to increase your risk of Parkinson's disease, get exposed to paraquat, which is increasingly commonly used. And again, 32 countries, including China, have banned the most toxic herbicide ever created. Pesticides are not the only industrial chemical associated with Parkinson's disease. Trichloroethylene, or TCE. Anyone use trichloroethylene? So trichloroethylene, widely used in dry cleaning, widely used by mechanics as a great degreasing agent, widely used as oil processors and printers, used in glues, used to decaffeinate coffee as late as the 1970s, used as an anesthetic, used as a carpet cleaner, paint remover, stain removers. 8% of workers in England have been worked with the chemical at some point in their life. If you worked in the electronics industry or in Silicon Valley or in the automobile industry or aerospace industry, you likely worked with this chemical. It contaminates up to 30% of groundwater in the United States. Up to 30% of the groundwater in the United States is contaminated with TCE. In addition, like radon, it can form plumes that are underground, migrate and evaporate like radon into people's homes, especially their basements, undetected. And so people can suffer from indoor air pollution, both in their homes, workplaces, and even schools. This is Danny Fromm, who used trichloroethylene in the aerospace industry in 1988. He worked cleaning circuit chips with TCE that he would just pour on unprotected from when he was about 18 until 26. And then when he was 35, he was diagnosed with Parkinson's disease. Today, he lives in Idaho with his family, and you can see his young son. He had deep brain stimulation to help him with his Parkinson's disease. But he says if you worked with this chemical or continue to work with this chemical, he would say recommends that you quit your damn job and stop working with it. In addition to people like Danny Fromm, these Superfund sites or EPA designated sites for designated toxic sites that are designated for cleanup are found throughout the country. You can find several in Cincinnati, Ohio, as you can see on this map. I found one 15 minutes from where I live here in Rochester, New York, because in addition to these Superfund sites, there are thousands of other sites that are contaminated with TCE throughout the country. Again, people who worked with TCE have a 500% increased risk of developing Parkinson's disease, 500% increased risk of developing Parkinson's disease. And you don't have to have worked with it. You could be suffering from having drunk contaminated groundwater in the past, or suffered from indoor air pollution. So the TCE is often inappropriately disposed of and often just simply dumped into the ground, where it can seep through the soil and contaminate groundwater and then evaporate into people's homes. This is the place near 15 minutes from where I live in Rochester, New York, where one of the residents was drinking water from, like all the residents were drinking water from a fresh spring called Modoc Road Springs. And when the New York Department of Environmental Conservation went around testing the springs, they found that this spring was contaminated with TCE. So the person could have been exposed by drinking the groundwater or being suffered from indoor air pollution, as this shaded area indicates the area that was contaminated. And then the TCE evaporates from the ground, just like radon from soil, and enters people's homes undetected. So they spend their entire lives inhaling TCE. It's not just found in Rochester, New York. There are over 20 Superfund sites in Silicon Valley alone. There are numerous sites in Michigan and Las Vegas, and likely if we could find some in Cincinnati, Ohio as well. Jane Horton lives across the street from one of these Superfund sites, which is underneath the headquarters of Google in Mountain View, California. She heard about it. She had her home tested and found to have TCE levels far beyond the safety levels. She had a TCE remediation system right outside of her utility box put into her home that sucks out TCE from underneath her foundation and has it vented above her roof. So those are some of the reasons why Parkinson's disease is some of the likely reasons that Parkinson's disease is the world's fastest growing brain disease. And then there are things that we can do to turn the tide. One, we can ban paraquat like 32 countries have done. We can ban trichloroethylene like many countries in Europe and the state of Minnesota and the state of New York have done in the US. Many of you know the value of exercise for those who do have Parkinson's disease. You may not know that vigorous exercise in your 40s, 50s, and 60s can decrease your risk of developing Parkinson's disease by about 20%. A Mediterranean diet, low in animal products, high in fruits and vegetables, can be helpful for people with the disease and help prevent the disease. Similarly, caffeine can be potentially beneficial for people with the disease. I can see Chris drinking a cup and be beneficial in terms of decreasing the risk. Many of you know that head trauma increases your risk of Parkinson's disease, so you should take special care to wear helmets when doing high-risk activities. At the same time, the number of Americans with Parkinson's disease has increased 35%. NIH funding for Parkinson's disease adjusted for inflation has actually decreased. Number of Americans with Parkinson's disease has increased 35% the past decade. During that same period, NIH funding for Parkinson's disease has decreased when adjusting for inflation. I can think of no other condition for where that is the case. We need to expand the way we care for people with Parkinson's disease by bringing care to you in your homes. How many of you have gotten care via telemedicine over the past 6 or 12 months? How many of you liked it? So, as far as a really convenient way of delivering care, I've been using telemedicine to care for people with Parkinson's since 2007. And we think that these changes that allow Medicare beneficiaries like many of you to receive telemedicine are temporary. They can be taken away when the public health emergency ends. So you need to make sure to tell your representatives and your senators to make sure that telemedicine, Medicare's coverage of telemedicine continues so you can continue to receive care at your home, especially important as the disease progresses and the burden increases both on patients and their caregivers. And then we need to develop better treatments for the disease. We've had more therapeutic breakthroughs for Parkinson's disease, levodopa and deep brain stimulation last century than we've had this century. More therapeutic breakthroughs for Parkinson's last century than this century. Not many conditions for which we can say that. We need better measures of the disease so we can get better treatments faster for those affected. So this is the PACT, P-A-C-T, that we have identified to help bring about the end of Parkinson's disease. We highlight the PACT in these and the black pages here highlighted at the end of the book. We provide 25 concrete steps to prevent and end the Parkinson's pandemic. And we need people like you to make your voices heard so that we turn the tide on Parkinson's disease and bring about the end of this disease that we have helped create. With that, I'm happy to take any questions that you have.
Thank you so much, Ray. And if we want to start maybe with the questions that folks have pre-submitted, and as we go through those, if you have other questions, speak up. We'd be delighted to answer.
So I see Susan Ullman's question about Cincinnati having a high rate of cancer. So it turns out that TCE, and trichloroethylene, and pesticides also increase the rates of cancer, especially TCE as a known human carcinogen by all routes of exposure. There aren't great data on Parkinson's by geography. One study by Dr. Allison Willis suggested that there might be higher rates in Cincinnati and Indiana. I wouldn't be surprised given the high use of pesticides in those areas and likely the use of TCE in those areas. But there haven't been great studies looking at Cincinnati and rates of Parkinson's, at least to my knowledge.
So we have another question here. A thank you for writing a book that actually has an action plan. This person has written letters to government officials, subscribed to environmental group newsletters. The book clearly states the reasons why we need to ban trichloroethylene, paraquat, and chlorpyrifos. How can we best educate the public about these harmful toxins in our environment?
So we have great models for how to change the course of the diseases. So some of you were part of the March of Dimes in the 1950s. How many were part of the March of Dimes? Right, so they were part of the March of Dimes. So what was the March of Dimes? The March of Dimes was literally people mailing in dimes to the White House to change the course of Parkinson's disease. So I'm going to read you a little bit about the March of Dimes. This is from chapter 3 of the book. So the March of Dimes came up from what was it called? It was the National Foundation for Infantile Paralysis, which was founded with FDR's support in the 1930s and 1940s. And a entertainer named Eddie Cantor had suggested a March of Dimes campaign that would involve asking people to send their dimes directly to the White House. Even though much of the foundation staff opposed the idea, the head of the March, what became the March of Dimes Foundation, asked President Roosevelt, who said, "Go ahead." With the president's endorsement, Cantor used his popular radio show to launch the March of Dimes effort to enable all persons, even the children, to show our president we are with him in this battle. Jack Benny, Bing Crosby, and the Lone Ranger soon joined the cause and made their own appeals to support the March of Dimes. The White House expected a modest increase in mail. What arrived instead was a tsunami. Ira R.T. Smith, who worked in the White House mailroom for more than 52 years, recalled, "2 days later, the roof fell in on me. We've been handling 5,000 letters a day at the time. We got 30,000 on the day that the March of Dimes began. We got 50,000 the next day. 150,000 the third day. We kept on getting incredible numbers, and the government of the United States darn near stopped functioning because we couldn't clear away enough dimes. In all, citizens mailed 2.7 million dimes, countless dollar bills, and numerous checks to the White House. The March of Dimes eventually became the official name of the foundation. That Monday supported Jonas Salk and later Albert Sabin from the University of Cincinnati to develop polio vaccines that ended polio. We don't have polio support groups, and we don't have polio research centers, and we don't have polio foundations, largely speaking, because we don't have polio. And we've ended polio. And if you think to the 1980s, think worse with HIV, where the victims of the disease were blamed for their disease, as opposed to being supported and cared for and treated. And they took advocacy to a whole nother realm. They blocked the streets of New York City. They took over the New York Stock Exchange. They took over the FDA. They took over pharmaceutical companies, because in their motto was silence equals death. The model the HIV Foundation act up was silence equals death. And for Parkinson's, silence is equal to a lot of suffering. And I would argue it's equal to a lot of needless preventable suffering. And there are 1.1 million Americans with Parkinson's disease. 1.1 million Americans have been diagnosed with Parkinson's disease. If those 1.1 million Americans mailed in a red letter or mailed in or called the EPA administrator, we would not have paraquat, we would not have trichloroethylene, and we would prevent generations from ever developing Parkinson's disease. 1.1 million Americans, if we mailed in red letters to the EPA administrator and said to ban paraquat when they reauthorized it in October of last year, we would prevent people from ever developing Parkinson's disease. And you know better than I do the burden of Parkinson's disease. You know what the toll it takes. You know the suffering that that comes with the disease. And you know that suffering is not just limited to the single individual who has the disease. It extends to their spouses, to their brothers, to their sisters, to their children, to their entire family. The challenge to us is to bring about the end of Parkinson's disease.
And if you like the red letter idea, a quick plug, we're going to be having an event in mid-March, and we will actually send you a red letter if you'd like to attend that event, that you can write a personal message on and mail to the White House. So more details will be forthcoming through your email network about that, but we will give you a chance to do that directly this March. So Ray, another question for you. Someone's curious about genetic testing. It appears from what they've read in the book that there's a lot of genetic-related research happening. Their husband and son both have PD. Would it be worthwhile for them to be tested, and could that lead to their ability to participate in research studies?
So the Parkinson's Foundation has a study called PD Generation. Maybe Alistair can put that study in the chat, and we're part of it at the University of Rochester. Which is seeking to better understand the genetic causes of Parkinson's disease, offers online genetic counseling to families like yours, where there's a family history of Parkinson's disease. And many of the genetic mutations, indeed the two most common genetic mutations, LRRK2 and GBA, that are associated with Parkinson's disease, have known interactions with pesticides and likely interactions with trichloroethylene. So just like only 10% of smokers develop lung cancer, only a small portion of farmers develop Parkinson's disease. Why is that? There must be other genetic environmental factors that are responsible for determining who develops the disease and who doesn't. And we're trying to identify what those genetic factors are. But if we can get rid of the environmental triggers, we can get rid of a lot of Parkinson's disease.
We have another question. The book mentions light-activated stimulation of the brain could one day replace deep brain stimulation. Can you tell us more about research being done in this area?
Yeah, so this is mainly a research tool which you can shine a light in the brain on certain nerve cells and turn them on and turn them off, almost like you flick a switch. And if you think about what deep brain stimulation does, is passes a wire or electrode into your brain to decrease the activity of a part of the brain that's overactive. And the thought is, now this is mainly a research tool. Can you think about turning off and on different parts of the brains without having to do surgery or to do that with a light? That's more science fiction right now than an actual practical application. but certainly a valuable and quite novel research tool.
And then on a related front, someone read an article recently that stated that 70% of people with PD have vision disturbances and/or worsening of sight. Do you see this frequently? Have you found this to generally be true? And if so, do you think it's attributable to PD specifically?
Yeah, so as I said, we got to stop thinking of Parkinson's as just like a brain disease. For the parts with the vision in there, it does affect parts of the brain that are responsible for bringing your eyes together. So when you read, if you look at my eyes, when I read, my eyes come together. And that's called convergence. That's the fancy term. And there's part of the brain that's responsible for bringing your eyes together. And that part of the brain is damaged with Parkinson's disease. So many people with Parkinson's have trouble reading. For example, it turns out that turns to be really treatable. If you get prisms which just bend light, you can have those put into your glasses and help you read better.
And to move back a little bit to the chemical front, are you aware of any researchers who are devising methods for measuring the amount of toxic chemicals in the brain, the blood, the gut, the respiratory systems to determine people's risk of developing the disease?
I think that's a great idea. And it's unbelievable to me how little has been done on that front. It turns out that TCE, trichloroethylene, the one that used for degreasing used in Silicon Valley, is rapidly cleared within hours, days, or weeks after its use, and it appears not to leave any clear markers of its presence. So there's no great way to measure your TCE level in your blood to tell if you've been exposed. Pesticides, on the other hand, some are fat soluble. So almost everyone on this call has DDT in their fat, or the metabolites, the breakdown products of DDT, because we've all been likely exposed to DDT. And so they have found DDT, for example, and other pesticides in the fat. One study looked at heavy milk drinkers, and it turns out that pesticides are often sprayed on the feed that cows can eat. And so the cows concentrate some of these pesticides, which I say dissolve in fat, they concentrate it in the cow's milk. And if you drink that contaminated milk, you absorb, and again, it dissolves in fat. And so you can actually find remnants of pesticides in the brains of people with Parkinson's disease. If that isn't scary enough for you, I have one worse. You can find residues or remnants of pesticides in the breast milk of nursing women. And so women who are exposed to DDT or other pesticides will have that pesticide in their milk and will be feeding that milk to their newborn children who largely have developing and relatively unprotected brains and can cause brain damage to their nursing children.
Awesome. Does anyone have any questions they want to share either via chat or via video? Cheryl, I see you raising your hand.
I just wondered, since reading your book, I'm reading it for the second time. I've reduced, almost eliminated dairy. Is dairy full of pesticides? It seems like it would be with getting it from the
several
cow's
studies. Several studies. First of all, thank you for reading the book. If you haven't read the book, before I forget, if you can't afford the book, we will send you a free copy of the book. We'll even send you a free copy signed. Just email us at info@endingpd.org. We'll send you a free copy if you can't afford it. All the authors are donating all of our proceeds to efforts to end Parkinson's disease. If you've read the book and liked the book, write a brief review on Amazon. It takes 2 minutes. We need to get the word out. Alistair will provide you the links. So there have been several studies that have linked milk consumption to Parkinson's disease. It's unclear what the nature of that relationship is. It may be that milk affects the antioxidants in a chemical called inosine, which might be reduced in milk drinkers. And there was a study looking at providing inosine to people with Parkinson's disease, but that did not work. I think that at least some cases are tied to pesticides. And I think that's perhaps why the Mediterranean diet, which has fewer animal products, might be advantageous. I'm not saying not to drink milk, but I would certainly consider organic for everything. If I had 50% of my nerve cells or 60% damage because of Parkinson's disease, I would avoid all other pesticides. So even since writing this book, and I didn't know most of this until I took a sabbatical to start reading this, I buy more organic. I wash all my fruits and vegetables with a little soap and water. I buy, I told you, far more organic. I have a water filter on my on the water that we drink because I don't want trichloroethylene to affect me or my children or my wife. And I, obviously wear a helmet and exercise vigorously. But I would reduce my exposure to pesticides. Another big source of pesticides is well water. So I know I'm speaking to people who probably, how many anyone drink well water? Anyone well water? No one, anyone used to drink well water? I'm sure there are people who got drink, yeah. So 40 million Americans, 1 out of every 8 Americans gets their water from wells. Private wells aren't regulated by the Safe Drinking Water Act, are tested infrequently, and tend to be in rural areas because that's why you need wells, and are relatively shallow and are susceptible to pesticide runoff from nearby farms. So people who drink water from private wells are like 50 to 100% increased risk of developing Parkinson's disease. And again, that exposure could have happened when you were a child, and the disease, takes years to develop. Just like, you don't smoke cigarettes and develop lung cancer the next day. You don't get exposure to pesticides and develop Parkinson's disease the next day either. Some of these exposures could have happened years or decades ago and be responsible for contributing to Parkinson's disease.
And Susan submitted a related question in the chat. What about other forms of dairy, such as yogurt or cheese, like in increased levels of processing? Do they also increase?
It seems like dairy as a whole is. Again, I think it's most likely tied to pesticides. So that means if you buy dairy that's pesticide free, it probably has little, if any, impact. But I could be wrong. Nonetheless, if I had Parkinson's disease, I would, if I like dairy, and I do like dairy, I would be looking for organic options. Otherwise, reducing it probably would be not the worst idea.
Additional questions from anyone? Raise your hand on your video, or yes, Carolyn, I see your hand.
I just had a question. You had indicated that there was a decrease in Parkinson's research, and I was wondering if much of that is because of the individual foundations that support Parkinson's, for instance, Michael J. Fox, that the coffers for those foundations have increased, and the government is saying, well, let them do the research.
So no matter how big the foundation, they all pale in comparison to the NIH.
Right.
So I think, just to give you a, Michael J. Fox Foundation spent like maybe 100 million last year, and I spent like over 200 million. And that's about as close as it gets. I think the Gates Foundation has spent like $35 billion a year. I mean, $35 billion in its entire existence. That's about the budget for the NIH per year. There is no funder bigger, more powerful than the NIH. HIV receives $2 billion a year. I could be off by a billion. $2 billion a year for research. That funding has prevented many of us and many of our children from ever getting HIV. If you think about the changes in sexual practices that we have discovered because of research, has led to therapeutic advances that now have HIV associated with a near normal life expectancy. The same cannot be said for Parkinson's disease. And more people have more access to HIV therapies than they do for Parkinson's disease. So if you have any questions about what money can do for changing the course of disease, look at HIV and look at that March of Dimes for polio. We need, Michael Oken, one of the co-authors, says we need to increase our funding for Parkinson's disease tenfold. And we need to stop, and we need to put a lot of that money to preventing Parkinson's disease. I'll stop with this final story. The woman who created what became the pink ribbon lived in Simi Valley, California, outside of Los Angeles, and her mother and sister both developed breast cancer, and she developed something called the peach ribbon, which Estee Lauder later made the pink ribbon. But she developed a peach ribbon. She handed it out, and basically in the parking lots of Kroger in California. It wasn't Kroger because they didn't have Kroger in California, but handed out notes with that peach ribbon that said, the National Cancer Institute spends $1.1 billion a year on cancer research, and only 5% of that goes to prevention. The first response to any pandemic, whether it's COVID or Parkinson's disease, is to prevent other people from getting the disease. It's far easier to prevent the disease than it is to cure it. We need to prevent subsequent generations from ever getting Parkinson's disease. We need to ensure that people with the disease can receive access to care regardless of who they are or where they live. We need to make sure that telemedicine coverage by Medicare is made permanent, and we need to develop better measures of the disease so we can get better treatments. The challenge on our Parkinson's disease is to a large extent preventable. It is not an inevitable consequence of aging. Parkinson's disease is not an inevitable consequence of aging. It is to a large extent preventable. It is upon us and people, fellow Cincinnatians and Ohioans, to change the course of the disease, just like we've done for polio and HIV before us, so subsequent generations can look back on us and say that we rose and met the challenge and prevented them from having to deal with Parkinson's disease, just like other people have done for polio and HIV for us. Thanks very much.
Thanks, Dr. Dorsey. This has been one of the most interesting PDEDUs I've attended in the last 3.5 years. I've got all kinds of questions and ideas, and I can't wait to engage in conversation with a lot of our constituents, and would encourage anyone who wants to follow up on what we can do in our local area. Reach out to us at info@parkinsoncincinnati.org. I wanted to share just very quickly so everybody knows what it looks like. And let me.
Chris, do you mind if I jump off? Because I have to run to
No, not at all. Well, thank you very much, Doctor. I know we've gone past our time, so for everyone, just a reminder, check at parkinsoncincinnati.org. We will have a recording of this session available for those who want to share it with family and friends. And again, Dr. Dorsey, Alistair, thank you so much. And to everyone, thanks for attending. Look for us in February for another PDEDU here online. Thanks, everyone.
Bye-bye.
Thank you.
Thank you.
Thank you all. This has been a wonderful session. I'm happy to stick around. I don't have something until 12:30, so I'm happy to stick around if anybody has wants to discuss more, or has any questions for me or anything like that, or jump off as you guys wish.
Thanks, Alistair.
I wondered more about exercise, like how much that contributes to decreasing the symptoms of Parkinson's.
Yeah, so I mean, we are big fans. We're big advocates of exercise. There's a national, or actually international organization called Rocksteady Boxing, which many of you may either participate in or be familiar with. I see some heads nodding. So there are also other boxing for Parkinson's organizations besides Rocksteady Boxing, but Rocksteady Boxing is kind of the market share leader. And we've interacted with a number of different Rocksteady boxing groups for us around New York State, but they've just been really fantastic experiences for all involved. Like, the stories are inspiring, you know, of people who have really bad symptoms and come in after, you know, sort of a short period of time attending sessions regularly, you know, their symptoms are much better. Certainly exercise, whether it's boxing or anything else, is very neuroprotective. And you know, we're big fans of that.
So Alistair, one of the questions that struck me when I was reading the book was, I noticed the heat map that Dr. Dorsey showed for paraquat use in the United States. Incredibly dense, not surprisingly, since it's an agricultural product, but incredibly dense along the Mississippi River, the Ohio River, the Missouri River, which means that essentially our water supply, even far away from the contamination's beginnings, gets delivered pretty much to everywhere in the country. Think about how many, you know, I know the city of Cincinnati draws its drinking water from the Ohio River. So, you know, my question is, as we look to try and change the regulations around these chemicals, are we partnering with the environmental community for as kind of a force multiplier? And if so, I'd like to figure out who we need to, as an organization, engage with in the environmental area to go advocate in Columbus, our state capital.
Yeah, absolutely. So I believe, I might be mistaken, but I believe the book lists a number of different environmental organizations, granted on a national scale, but there will likely be local chapters of them. But yes, absolutely. I mean, I think in this respect, the objectives of both us and those organizations are very aligned in terms of preventing paraquat use. You know, and I have some friends who are farmers or whose families have farms, you know, around the upstate New York area, where Rochester is located. You know, and even, you know, even without pesticides at all, there are a number of different farming practices that can achieve the same level of pest reduction, for lack of a better term. You know, and certainly I would imagine, I'm not an expert on this, but I would imagine that there are pesticides that could be used that would be safer for human health than paraquat. You know, the EPA's own website, literally the title for the paraquat page is "Paraquat dichloride, 1 sip can kill." And they have these anecdotes on the EPA's own website of, you know, the 8-year-old boy who drank out of a bottle of Dr. Pepper in their garage, was taken to the emergency room, you know, died a few days later. You know, someone who, you know, put something in the wrong spray bottle and you know, was therefore exposed. And, you know, and oral ingestion of paraquat will kill you in a week or two. You know, and so there's a decent body of evidence to support the fact that we really shouldn't be using this all over the country on our crops, as the heat map you mentioned indicates.
Anyone else?
Oh, I have another question.
Yeah.
Where do we
go.
start, like in our action, Alistair? There's a lot of choices.
Yeah, so I would say there's where you start on your action to some degree is dependent on where you think that you as an individual can make the most impact, and what is most important to you as an individual of those action items that are in the book. I think as a general principle, you know, prevention is a very good place to start, because for every month, for every week, for every year, you know, that we continue to use paraquat, we continue to use TCE, we continue to use some of these chemicals, more and more and more people are going to develop Parkinson's. And so this kind of echoes what Dr. Dorsey said just shortly ago, you know, in terms of if we can, you know, if we stop using those, you know, today instead of in March, that's going to mean a whole lot of people who won't develop Parkinson's. You know, and if we stop using them this year rather than 10 years from now, that's going to be a really significant, you know, a really significant thing. Obviously, that's something that is, you know, your voices add to the chorus, but, you know, you alone probably are not going to be able to wave a magic wand and automatically stop these things being used. So it's important to advocate. It's important to send your things in. But if you want to get involved on a level where you yourself can, you know, sort of make an immediate impact today, there's also a number of research-based initiatives where there are clinical trials across the country, across, you know, different objectives, et cetera, going on. I'm sure that Parkinson's Support and Wellness has somewhere either listings or links out to some clinical trials that you know, you might be eligible to participate in. We ourselves keep a neurology registry, which essentially asks you to provide some contact information, a little bit of background about yourself, so we can help match you to trials. And we are the coordination center for a number of different, either fully virtual or national multi-center trials. So that's a simple online form. We ask you to fill out about 3 surveys, and I'm actually going to put the link in the chat here. So anybody can go and sign up right after this if you're interested. Yeah, so participating research is something that you can do very immediately. And then on the prevention advocacy front, obviously those are very, very important initiatives. Yeah, Marilyn.
Hello, Alistair, thanks so much. Following up on Cheryl's question, the red letter event, will we be able to distribute those widely in our communities?
Yes, absolutely. The more the merrier for for that one. We'd be delighted to have a whole bunch of people attend. There are 1.1 million Americans with Parkinson's. We would be delighted if 1.1 million people showed up. We would much rather have 1.1 million people show up and have to figure out what platform we're going to use
Right.
than the alternative. So please, everybody here today, you are all invited. We would love to have all of you attend. We'd love to have all of you spread the word to your communities and to other people you think will be interested. The event's going to be on March 16th, and we haven't opened sign up for it yet. We haven't finalized platforms and all that, but more details will be forthcoming, and I'll be sending that to Chris and Cheryl, who will make sure it gets distributed to everybody. But March 16th, mark your calendars. Yes.
Alistair, I have one more question. In the book, I read the book, but I didn't remember seeing anything about PFAS, the forever chemicals that stay in the water and in some of the firefighters' foam. I don't remember, the PFAS, forever chemicals. I don't remember if Dr. Dorsey or any of the other authors mentioned the toxicity of that.
That is a really good question. That's one I don't know off the top of my head, just candidly. What I would say, Dr. Dorsey responds personally to all questions submitted to the info@nepd.org email address. So if you want to write him a quick email to info@nepd.org, he'll get back to you in a day or two.
Sure.
With the answer to that question.
Very good. Thank you very much.
Of course. Other questions, thoughts, ways we can be helpful? Yeah, Carol.
I know that the military spent a lot of years getting Agent Orange coverage for people with PD. We have people in our community that have benefited. Is there any kind of, this whole thing feels kind of frustrating sometimes because lobbyists and people like that seem to have so much more control over what gets done than individual citizens. And what we really need is for the government to go after these companies and have to share in the cost of care for PD. But that's going to take major, help from the government. And with lobbying causing being such a big issue, how can we make progress on something like this?
Yeah, it's a great question. So politics, I would venture to say, just generally operates off of what I would call an inertial principle, which is everything happens very slowly and then all at once. And I think we have seen that for the last decades, as well as just in 2020. And so one thing that we can do is we can put Parkinson's, and this is to the advocacy point, we can put Parkinson's on the radar screen in the big leagues when we're talking, Congress, the White House, those types of places. The red letters is one way of doing that. 1.1 million Americans with Parkinson's. Imagine if 1600 Pennsylvania Avenue got 1.1 million red letters that showed up within a couple days span. You bet that's going to be on the agenda. And the thing is, once, and we've seen this again, time and again with political movements, once something has impetus behind it, once something is moving, once something is the topic of discussion, there's typically with news cycles a critical 3 to 4 week window to kind of do a whole bunch of stuff that's actionable that might take 10 years to accomplish outside the impetus, but there are resolutions passed, and there are and depending on what it is, executive orders, there are other things, and just boom, 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 things roll out. So on the one hand, that's a key way of kind of doing that to support that when that eventually happens, and it will happen eventually. If I would be in politics, if I could predict exactly when that will be, but that will happen eventually. And to support that, we need to continue doing research and building up stronger and stronger and more conclusive bodies of evidence that support this. So one of the reasons why Agent Orange was eventually covered is because there's such a robust body of evidence to support, Agent Orange as a risk factor, and people could trace, you could trace people to, documented exposures, documented sites of deployment or work sites, even documented tasks relating to Agent Orange. And, because it's a military application, everything is so carefully kept track of. And that's something that doesn't necessarily exist in any kind of centralized form right now. Certainly people have done studies, but it's impossible to do the same kind of causative clinical trial that you might otherwise do, because you're not going to randomize people to be, exposed to any of these chemicals. So it's kind of a two-pronged approach. One of the advocacy, and especially that critical push when it makes the the national news cycle, and the other one of them being a steady effort to build up that body of research. And so therefore, if you have been exposed, any of you, to any of these chemicals at any point in your lives, that is, to be on the lookout for opportunities to contribute to those types of research efforts and contribute to building that body of knowledge. And, when there comes an opportunity to do those types of red envelope, campaigns to participate and get everybody, to participate. There's actually one other organization that I wanted to share on that front, which is a great group called PD Avengers. I don't know if anyone has already signed up for this, pdavengers.org. Actually, is it .org or .com? Sorry, forgot. pdavengers.com. Sorry, let me retype that there for everyone. Avengers.com. And PD Avengers are a great group. I think there are a few thousand people now signed up for them. They were founded by a radio host in Canada who wanted to create a platform for advocacy, create a platform to be able to spread the word. Takes all of 30 seconds to put down your name and email to sign up for that. And you'll get, you can, I think, customize the frequency, but you'll get like monthly or weekly action alerts for, hey, here are the, 5 things you can do this time period, to help with this. So definitely recommend that everyone sign up for that as well.
Thank you.
I'd remind everybody that we also have a pretty significant research, Parkinson's disease research program going on at the University of Cincinnati at the Gardner Center. It is the Cincinnati Cohort Biomarker Protocol. They're looking for up to 10,000 participants. You need not have Parkinson's disease diagnosis to join in, but you can find that just by Googling CCBP study and find out about that. And actually, the head of that research program and a member of our program committee who is also working with Dr. Espay will be a primary speaker at our Spring Forum event on April 10th, which will be another virtual this year. Hopefully 2022, we'll be back to getting to hang out together in person. Alistair, thanks so much for giving us so much of your time. I know it's you're at a full 2 hours on this one, so
thank you, Alistair.
Look forward to talking with you and working with you in the future. I've got probably more questions bubbling up. I'm just filling up my notepad, so I'll be reaching out to you. I want to specifically also thank Cheryl, who is a member of our program committee and who engaged with Alistair and Dr. Dorsey to make this happen. Cheryl, thanks so much. And to all the rest of the folks who volunteer their time on our program committee. Thank you so much. With that, I'm going to go kill a dog.
Thank you. This has been absolutely delightful. A lovely 2 hours. Chris, Cheryl, thank you to both of you, and thank you to everybody who came today. It's been a real pleasure, and glad to continue the engagement. And thank you, everybody, for all that you did.
Thank you, Alistair. Have a good day.
Take care.
Thanks, everyone.